Welcome to this episode of JING TV, and we're going to talk about one of those things that sometimes is like above the obvious. It's sort of like, how do you set up your massage room? What are the key elements that set the scene for massage?
Yeah. So, first of all, I would say, like, have a massage room, you know? It's like, I mean, people have told me, it's fine if you want to work from home, lots of people do that, but really try and have an appropriate environment, so not just setting up your massage table in the middle of your living room with all your stuff around. So there's definitely something for me about having an environment for massage that's dedicated to massage.
Yeah.
And it's quite interesting because I'm quite messy in my normal life, but when I had my first massage room, which was working from my home, I was really like, oh my god, it's got to be really tidy.
Fastidious.
And it really affected me, sort of like how it felt. So I think I go for what I like is a bit of, you know, clinical, well, not too clinical, so quite clean, sort of aesthetic. I'm thinking my clinic in Brighton, the pain clinic, and there's a big Chinese symbol on the wall that somebody hand painted for me.
But can I just say something about that?
Of course you can.
So I think one of the most important things is not being ingenuous. So
okay,
I think the thing I see in some clinic rooms I go in, and you say there's like this big Chinese thing up in the pain clinic, and the second part of that's so important that somebody painted for you, that you were as part of class.
Exactly.
And I think one of the things
it's
that really
not an Athena Chinese symbol
really turns me off is that people buy like a clip art and you know, be like these stock massage images. And in fact, we just did a webinar with Ryan,
massage nerd,
who's doing this big piece of work where he's getting out real massage images. And of course, you know, with the new JING book coming out, it's got tons and tons of real massage images. But what really turns me off is I go places and there's like lavender writing and massage pictures of people with horrible nails and people's heads to the side.
Not real massage.
Yeah, and often like you know a dolphin going like that. You know, something that just seems so, I don't know, corporate, but corporate of the 80s. So you know, make sure that in your room, even if you're buying stuff off the shelves or off online, that they're things that mean something.
Yeah,
to you.
I think so. And thinking about what image that you're portraying. So if you want to have a very clinical medical environment, then yes, absolutely, muscle charts on the walls, you know, pictures of...
But don't put a muscle chart on the wall if you don't know what they mean. I mean, I know it sounds ridiculous, but I just think people think, oh, I'll put this muscle chart up because it'll make me look official. I'll put the skeleton somewhere because it'll make me look official, which it does portray a particular image, but know how to use those things. If you think that that's an image that you want to portray, then that means to me that that's the kind of therapist you want to be. So it means that those are instruments that you should be able to use and use to demonstrate. So for instance, a lot of people at JING go off and get the clinical charts of trigger point therapy, which helps them feel like they have a reference in the room rather than, you know, using the books or something like that. So
absolutely.
Got a lot to say about that.
You have got a lot to say about it. So I think, I mean, there's lots of different aesthetics in massage, isn't there? Because we are such a broad, you know, broad church, really.
A therapist,
So, you know, I mean, what's your feeling really? And so what do your massage rooms look like then?
Oh, I've had everything. And I think, you know, it's important to realize that Rachel and I have both been mobile. We've had treatment rooms in our homes. I remember the first room that I could dedicate to massage therapists, which wasn't actually a sole dedication room, but it was a room I had in San Francisco. And so I chose to have a futon as a bed so that I could fold it up during the day.
Yeah, I've done that.
Yeah, and treat from that room. And it was almost like, you know, I wanted to be like a Mission Impossible or Man in Black, press a button and everything sort of changed. But I think simple, clean lines. So I'm always a big fan of white or cream. I always feel like dedicated massage linens are really important, you know, couch covers and things that, you know, wash easily. And I think I am a fan of a candle. I am a fan of luxury. I feel like I've always had heaters on my tables or kind of like a water bed kind of thing. So I use all of that because I like it and I think it helps.
And it's part of service, isn't it? You want people to be comfortable and the environment matters. And people,
heat.
Heat,
a lot
yeah,
of heat.
lovely. Yeah,
I think
fantastic.
also I'd love a steamy, you know, one day when I grow up I'd like a steamy towel cabinet. I think that that's really important. So I think, you know, colors are important. Trying not to be predictable, I think, in that environment.
Yeah, yeah, absolutely. And I think it's the difference between, I remember when, well, actually the school that I worked at, which was amazing, but the clinic that we did treatments from, it was very clinical. It was one room without
you had
a
those
window,
polo shirts with the
quite a hard table, and the couch roll was like really sort of not very nice to
couch roll. I think
lie
is
on.
great in some respects around the face cradle, but I'm not a big fan of it underneath the body.
Yeah.
So that's something that we've dialogued with around for a period of time. I think also just always recognizing that you have an adjustable table that you can change for the different people that are coming in. I think 2 chairs in a treatment room so you can have that discussion with your client so it's face to face. I think that that's really important.
And I think I have had to do this on 1 or 2 occasions, but really try and have a room that hasn't got a bed in it when you do massage.
No, it's
like,
weird.
you know, that's happened. You've got a massage couch and then there's a bed. It's just weird. It's just slightly...
Like in your own house.
In your own house. So if it has to be a bed, if you have to have a bed in there, make it not look like a bed, make it look like a couch.
Yeah.
Yeah.
And... you know, these are the things that seem really simple, but I think, you know, what we're doing here at JING TV and sort of with all of JING is like bringing this stuff to the surface so that massage therapists don't have to feel like you're alone with these issues. So maybe we haven't answered all the questions, but maybe we've started a dialogue. So you should continue the dialogue on Twitter, on Facebook, get involved with the JING community, because a lot of people have these same kind of questions, and Rachel and I don't always have all the answers. You have the answers out there. You all have your treatment rooms. So thanks so much for tuning in,
Thank you.
and we'll see you next time.
See you next time.